Classically, for interstitial lung disease or for pulmonary fibrosis, what we might hear when we listen to the lungs would be almost like a static kind of crackly sound when people breathe in. That is a very simple and non-invasive kind of screening test that you can do to see if there is anything like that going on. But at the end of the day, and the most important point is that if you're not sure about whether there's any kind of residual scarring or anything like that left, or even perhaps more severe scarring that's left over, the only way really to know is with a CT scan.